Now in studio, we want to shift gears and get into our second interview. And I told you earlier that we are going to be talking about health matters this morning. And in studio with me is Dr. Sultan Matendechere. He is the head of National Public Health Institute. Thank you so much for creating time for us.
Thank you for having me.
Yes, of course. Yeah. And we just want to talk about, what's happening in the health sector, plus your docket as the head of the National Public Health Institute. But first, I'd like us to begin from what is to happen in Mombasa County. All focus is on that particular county. There is a very important health conference that is going to be taking place. Probably just tell us a little bit about this conference and its significance and why now.
Yeah, so thank you very much, Serfine. The health generally is a very dynamic area. So you find that every day there are new challenges that are coming up. For example, in 2019, we did not know about COVID-19. But in 2020, from 2020 to date, that has become the big thing. In fact, that's become like the center of our focus. And then every day we are coming across new ways of going about interventions, new ways of doing things. We are discovering, redundancies in the way we are carrying out our functions. So it is important that from time to time, we need to keep on, adjusting, the way we do things. And one of the best ways in which we can do that is to adjust the training curricula of health professionals so that we can now align those curricula with the modern realities within the medical practice. So what we are doing now is that in conjunction with the Ministry of Education, the Ministry of Health has planned a very big conference which is going to be held in Mombasa County, as you have indicated. And during this conference, a lot of discussions are going to be held about how to better adjust the training programs, the academic curricula, so that we can ensure that the human resources for health, the personnel that are going to be produced by our institutions are up to speed with the challenges that we are going to be facing in the future, and even the ones that are here today. Yeah, so it's going to be, a conference that will take into account quite a wide spectrum of issues. There will be stakeholders from across board, because remember that even beyond the health sector, public health spreads across quite a number of sectors.
That's the International Conference on Harmonization of Curriculum and Training of Health Professionals. It's an international forum that is going to be held right here in Kenya. Probably, what would you say about the different stakeholders who are coming together and putting their heads together in this? Perhaps the Ministry of Education, the Ministry of Health, and other stakeholders from different spheres. Why is it important for them to be here?
Yeah, so of course, as I have indicated, health is not just a siloed service. We have a lot of influence from other sectors. I'll give you the example of, say, the water sector, for example. You realize that when COVID struck, we keep on talking about COVID because it's the dominant problem
right now
that we are having. One of the main public health interventions that we have taken to is, frequent hand washing, and that requires that we must have enough supplies of safe water. So you can see how important this is to just COVID itself. But another interesting thing is that since the COVID-19 outbreak came up, we have now seen a big reduction. In our statistics, we are able to see a very significant reduction in the number of cases who are visiting our facilities, who are affected by diarrheal diseases and other diseases that were high up there. And one of the things that we can be able to attribute this reduction to, actually we have seen a marked reduction, Serfine, I can tell you this, is the increased availability of safe water that is now being used to try and mitigate the impact of COVID-19. So you can already see how important the water sector is. We can say the same for very many other sectors. Like, for example, the ministry responsible for livestock. There are some diseases which affect animals, which affect human beings as well. the ministry in charge of wildlife. These are diseases that affect animals. So we are talking of something called One Health, where we are saying, apart from just concentrating on human beings, we know that diseases like rabies, they also affect dogs. So how do we now control these diseases in human beings, but at the same time, we also try to make a deliberate effort to control in dogs diseases like hide-a-teeth disease, which are spread through dogs and other animals. How do we ensure that we break that cycle so that we protect human beings in a better way? So you'll find that the stakeholders are being drawn from very many sectors. It is an open conference. Actually, everybody is invited, those who are interested in sharing, in participating in this discussion, because what we are going to come up with is something that will be drawn from the recommendations that will have been obtained from across board.
And it's not just in Kenya, the stakeholders are being drawn from across the region as well.
Yes.
I'm drawn at the theme, repositioning today's health workforce for the future. I like how futuristic this is. What does it mean for you, this theme? One of the things that we are now coming to grips with is the fact that, the whole phenomenon around globalization. Things are changing very fast. It's not like in the past where people were confined within their geographies. Today, somebody can have breakfast in the UK and dinner in Kenya. Tomorrow, people are moving all over the place. And, there is a lot of there is a lot of trade that's going on, there is a lot of interaction across borders. And so we are seeing a situation where something that occurs in one place, maybe like an outbreak that occurs in one corner of the world, will be in the other corner within no time. So we are seeing a very new dynamic around the health space, which means that we really need to be ready. We have to be ready. We cannot wait. We cannot afford to be reactive. We have to be proactive. So we really have to now embrace ways in which we can forecast, we can leverage data more so that we can forecast, we can prepare our professionals to be much more proactive so that when an emergency occurs, it does not get us by surprise. Now with the globalization that I'm talking about, it's very likely that you might start seeing emergencies, public health emergencies like Ebola, landing even in Kenya, because now we are having increased movement. How do we handle that? How prepared are we for that?
So
how
the future,
is the workforce, the health workforce, prepared to handle that? You remember when COVID came and everyone sort of was like caught by surprise, and we were running up and down trying to put our house in order. But so far so good, I would say. We have managed it well. I don't know what you think though about how we have handled COVID so far.
No, I think given the circumstances, we've done absolutely well. And the biggest thing I'd really like to talk about is the global action. Because I think for once we saw all stakeholders across the world coming together and putting their heads together to try and see what, all the time we were just on toes trying to see what is the best way in which we can be able to handle this phenomenon. And there was a lot of learning. To date, actually, there is a lot of learning that's going on about COVID. At first, we didn't know what it is. So we had to keep on, latching onto every small bit of information that we had to be able to make use of it to design interventions. But now we have received a lot of information. We have been able to understand the virus much better. We have been able to understand the dynamics around this disease much better. And so we have made a lot of strides towards being able to overcome the disease. We are not yet out of the woods, but we are in a much better place as compared to
where we were.
Where we were when it started.
All right, true. No wonder we are having this international conference on harmonization of the curriculum and training for health professionals to prepare our human resource for health for this future, this uncertain future. We do not know what will come tomorrow. So I will be talking more about that later. But I want to take you to something that I also wanted us to touch on, the National Public Health Institute. It was just recently gazetted. Many are still yet to find out more know about what its mandate is and what value add it's going to bring in the health sector. Maybe just take us through that as we start that conversation as well.
Yeah, so thank you very much. I think that's a very important question because, you know, as you have correctly put it, the National Public Health Institute was gazetted. You know, it was established via gazette notice, a legal notice in the Gazette, Kenya Gazette, on the 21st of last month. Is it last month? Mm-hmm. We are already in February.
Yeah, we already in February.
Okay, so no wonder we didn't say Happy New Year. I hear that it ends at the end of January.
Yeah.
So it was just about less than 10 days ago, actually, around 10 days ago. You know, the president gazetted it. This is kind of like a semi-autonomous institution. Mm-hmm. It's a state corporation which is going to support the various sectors that are involved in public health. Mm-hmm. Now, when I talk of public health, I would like to even just tell you that public health is much broader than we think, because some of the best public health practitioners, for example, are mothers. Because if mothers do not do what they do, you know, they actually implement a lot of public health from the time a child is born to the time this child is able to become independent and run around. You know, breastfeeding, making sure that hygiene is observed, making sure that these children sleep enough, you know, long enough, carrying out, you know, checking to see if there is any infection so that they can rush them to hospital. There's a lot of primary health care that is happening within the home. And mothers actually are some of the best public health care, you know, public health practitioners.
But do they get the credit for that? That's on a light note, though.
Yeah.
But
so it just gives you a very broad, you know, the scope of public health.
Yeah.
So what we are doing is that we want to try and see how to. We've learned a lot from the COVID-19 pandemic, and we have also drawn lessons from other epidemics that happened before. Case in point is the Ebola outbreak of 2014, which happened in West Africa. And this is the time we actually saw countries like Liberia, countries like Sierra Leone, countries like Guinea, almost coming to their knees because of those outbreaks. You know, the health systems in those countries were completely decimated, you know. But we were also seeing that other countries in the same region, like Nigeria or Guinea-Bissau, they were doing quite well, you know, in handling the pandemic. In fact, we had to send our health professionals to Sierra Leone and Liberia to go and support, you know, the response there. The whole world had to descend on those West African countries because they were actually being destroyed by the epidemic. But what we learned was that Nigeria by that time had already formed its National Public Health Institute. They call it the Nigeria CDC. Guinea-Bissau, surprisingly, had already established a National Public Health Institute. And these were able to help those countries to coordinate their response because they had all the necessary functions under one roof. They were able to prepare better for the epidemic. They were able to detect it much better and much faster because the public health laboratories are under that same organization. They were able to communicate to the public much faster, and they were able to give factual information. So it became very easy for them to contain. And that is what we are looking at now when we actually talk of now coordinating the existing public health functions within a more organized institute.
Yes. As you go on, I just want to get something clear, because we have the Ministry of Health. One would assume probably that should be part of their mandate. What's the difference? What's the biggest mandate of this National Public Health Institute that informed its origin, its genesis? What do you stand for?
Yeah, so generally the National Public Health Institute cuts across sectors. Of course, the Ministry of Health is a key sector when you look at public health. But public health, generally, I would give you the example of a house. Between the roof and the doors and the windows and the walls, which is the most important? Because when it's raining, you can say it's the roof that's most important. When thugs are coming, you can say it's the door that's most important. When you want light to come in, maybe the windows are the most important. Generally, during the day, you can say that maybe the walls are most important. But you see, all these things have to work in concert. You cannot have the bricks separate, the doors separate, the roof separate, and then you say you have a house. So what the Public Health Institute is trying to do is to bring all these functions into a well-organized and coordinated function that is better able to deal with public health emergencies. Now, for us, we have opted to anchor it on the Ministry of Health. But believe you me, the functions are going to be spread across, because we are having a lot of functions in the Ministry of Agriculture. We are having a lot of functions in the Ministry of Defense, because health is a health security is a security issue. COVID-19 has killed more people than war has killed in the last 2 years. Even accidents. Yes. Yeah, so this is a health security issue. So we have those components. I talked about trade, the Ministry of Trade, as we are doing cross-border trade and so on. Ministry of Transport, because of globalization. So there's going to be quite a bit of intersectoral collaboration, and the Public Health Institute now tries to bring all these sectors together. In Kenya, we are anchoring it under the Ministry of Health. Other countries like America, their National Public Health Institute is the America CDC. It's very well known. It's the one that has been leading, coordinating the Ebola, the COVID response and so on. Theirs is anchored under the Ministry of Defense, and it supports the State Department for Health and other departments. But in our setup, it is much better, situated,
all right,
supported by the Ministry of Health.
All right. So I just want us to know what is currently your main focus, your priority areas as an institute. What is it that you term as your objectives, the things that you plan on doing in the next few months or years?
Yeah, so we have come up with a strategy, because this is something that will be established over a long period of time. But in the immediate term, and we talked about it just a few minutes ago, one of the main functions is public health workforce development. Like what we are going to be discussing in the conference. Yeah, so we want to engage right from school, getting people to get interested in public health, putting the necessary framework, engaging with universities, introducing innovative courses like field epidemiology and laboratory programs within universities, where now by the time people are graduating, the workforce is coming into practice. They are already very well grounded with practical skills to be able to implement. So that is one of the main functions. Another major function is research in public health. And when I talk about research in public health, it is, yes, it might include the kind of research that we know, the hard scientific research. But we also want to be able to encourage our people out there to conduct operational research, so that someone who's sitting in a health center in Kacheliba, or maybe someone who is in Lunga, in a hospital, or even in Mandera, they can be able to observe something. They can start observing a trend. And we want to encourage them to be able to document that. They start taking data. They say, today I've seen 8 people coming here. They were complaining of headache, but at the same time, I could see that they had this very interesting rash on their face. And then we can start asking ourselves, could there be a link between this headache and this rash? Then we can now collect that and see in how many other places is it happening. So day to day, we want to encourage people to participate in that kind of research that can now help us to focus on the priority public health problems within our jurisdiction. Today, a lot of the research we are doing is dictated by external, funding agencies, grantors who come in and then they use our institutions and our people to conduct research. But we want to now pick the actual problems that are happening in the country, public health problems, and research on them so that we can influence policy, we can, inform policy, we can inform decision making. The third very important thing is around after we've developed workforce, we have looked at research. We are looking at public health laboratory systems. We are looking at surveillance systems. And then we are including issues around emergency preparedness and response. So when something happens, like for example, if something happens here in KBC, we are able to pick it very fast, you know, within our public health system. And then we are able to quickly coordinate with our labs so that they come and take samples among the, you know, the workers here or something. And then they're able to say, there's an outbreak of something in KBC. Then we contain it immediately before it gets out, you know. So public health laboratories, surveillance systems, including emergency preparedness and response. So that if we had a very good public health system, one thing I'll tell you is that the National Public Health Institutes are going to be linked. You know, like we have the Africa CDC, which is working on linking public health institutes
across
in Africa.
The countries in
yes,
Africa.
in Africa. We have other similar structures, the America CDC, the China CDC. So if we link all the national public health institutes in the world, if something like COVID happens the way it happened in Wuhan, China, we are able to detect it very fast, and the whole world is able to come together and support China in containing it before it gets out of Wuhan. So that is something that is very important. Of course, there are other functions, but in the immediate term, that is what we are looking at. Those three functions are the ones we are looking at consolidating before we can even now start moving to other functions like disease prevention, you know, things around population health indicators, you know, being able to communicate to the public, things around the data management and so on, which are going to come even as we move along.
So there's a lot in your basket right now.
Absolutely.
So you hold the steering, and how would you describe the takeoff? It's just the other day this was gazetted. How would you describe your takeoff as an institute?
Yeah, so I think, by the way, much as it was gazetted on 21st of January, efforts to establish this institute started more than 6 years ago in Kenya. And I personally came in as the head of the National Public Health Institute last year in August. And the first thing I did was to try and find out why is it that this institute is not being established. And I realized that there were so many things, so many factors that were at play. For one, I noticed that a lot of people didn't, you know, they were having fear of the unknown. What is this thing that is coming? You know, it sounds like a monster. How is it going to affect me as an individual? My program, you know, we have different people heading different programs today. My program is going to be swallowed by this monster. Where am I going to end up? So there has been quite a bit of resistance, but at the same time, there has been a lot of support. So what we have done is that we have deliberately allocated plans to be able to conduct something that we are calling change management, so that we can reassure all the stakeholders that this is not a monster that is going to swallow you. The other day I saw on social media when the president gazetted the institute, a lot of people were saying, what about KEMRI? You know, KEMRI should have just taken over this job and we do it.
There's that concern about duplication of roles and whether as a country we can afford that luxury. I mean,
Yeah, so I think it's more of, you know, lack of information, because there's not going to be any duplication of resources. In fact, what we are going to reduce is duplication of effort, because you find that as it is now in the public sector, there are a lot of duplications happening in different sectors. So now the National Public Health Institute, when it starts coordinating across sectors, we will now reduce that duplication of effort. We are going to reduce wastage of resources, which is happening at a very big rate now. We are going to introduce leadership, because there is a lack of leadership, there is lack of accountability, and that is going to impact very heavily. So, you know, engagements like these ones are very important, because now we are able to even talk to the public, the general public, and inform them very openly about what we want to do and how we are going to do it, to reassure all the stakeholders so that we can move forward much faster, you know, in this very important process.
All right. Thank you for helping us understand the key mandate of the National Public Health Institute. I know that in the future we will be having such engagements on more that you're doing and more that you plan to do to better the health sector. As you're just about to wrap up, I want us to talk about now the state of our health sector. And according to numbers I've come across, I don't know how true this is, you can confirm, is that about 10 million Kenyans, you know, travel abroad annually to see seek treatment for specialized special cases. And this is coming to a figure of about 10 billion that is spent annually as Kenyans do that. It's called medical tourism. Does it, mean that there is something we are lacking within our borders? Probably we are not able to, better take care of our population. What does it, what picture does it paint about our local health system?
Yeah, of course, it's something that concerns us quite a bit, and that is an area that we really want to be able to handle. There are many reasons why people are moving outside to go and look for treatment. One of the things I can assure you is that, and this one you can even check, our health professionals are some of the best in the world. Actually, when Kenyans go out there, they excel. Our doctors are the best in the world. Our nurses are sought after all over the place. We have very good health professionals.
So we also export human resource.
Oh yes, we actually seeing quite a bit of movement of human resource outside. But
so does it speak something about how we are treating our health sector and our health professionals? Does it? Yeah.
Of course, it has a little bit of a bearing to what the health sector looks like. And that's why the health ministry has, lately we are undertaking a lot of reforms. You'll realize that right now the cabinet secretary has been on the forefront trying to ensure that we are establishing all these kind of institutions that are going to make delivery much better. And I think what we also need to learn from other countries like India, for example, where there is a lot of these medical tourism, so to speak, that you're talking about. How do we even just approach the delivery of healthcare services? I'll give you a small example because I know maybe we are running out of time.
Yeah. When
you go to India, and that's the importance of being able to pick from other people who are doing it differently. You'll find that different, there they specialize, they specialize completely. It is also the practice, among the professionals themselves. So you'll find a specialist who is trained in a certain area, just focuses on that area. Yeah, it doesn't mean that they cannot do something else, but they just focus on that area. And they work in collaboration with other specialists. So if you come to me and you have a problem with your eye, and I am a specialist of the heart, I will send you to my colleague who is a specialist of the eye. So I focus so much on just the heart. So you'll find that every day my colleagues are sending to me these people with heart problems. And even if it is surgery, I will be doing almost the same kind of surgery every day. What is the impact? I will become much more skilled,
And you keep learning and growing.
I'll do it much faster. I will need less inputs. I can even be able to do it using less, supplies and things like that. So the end product is it becomes much cheaper. You get? Much cheaper because of the efficiency that we are introducing. And that one alone is something that we cannot really do, just by saying that now we are introducing efficiency in the system. It is something that also involves the practice, the behavior, and the general way in which things are done. So there's quite a bit that we can learn from, best practice that we can learn from other areas. And I think Kenya, we have all it takes. If you look at the facilities we have, if you look at the kind of professionals we have, if we just tweak a few areas here and there, we can actually provide even much better than what we are going to look for in India.
Could it be perhaps that also we are missing the point as Kenyans, not knowing what we have within? Because I've seen also other reports saying that patients from African countries like Nigeria, Tanzania, Rwanda are coming to Kenya for specialized treatment. Yeah. Could we be looking elsewhere for what we already have at home?
Yeah, and I think also there is quite a bit of messaging that needs to be done around this. And the other thing also is misinformation, I think, which we also need to look at. But another issue that I have also seen with our counterparts from other countries, like, for example, you gave the example of India. They are very aggressive in marketing some of these services that they provide. You'll find even on social media they are writing to you and telling you, we provide this, we are getting patients to come so that they can be treated here. So probably it is not that we lack, just what I said, it's not that we lack the expertise, In fact, as you have correctly said, a lot of people are coming to Kenya, you know, to seek specialized treatment like cancer. We have some of the best, pediatric hemato-oncologists, for example. You know, people who have just specialized in cancers for the young children, you know, blood cancers. And you find people coming all the way from Nigeria, you know, all over to come and look for this expertise here in Kenya. So I think it's something that as we move along, we should be able to pick it up and bring it out the way it's supposed to be done.
All right. Thank you so much, Daktari, for creating time. Unfortunately, we've run out of time. That's the much we had for you this particular morning. I'd just like to allow you to have your parting shot. And also, as you do that, you tell us what is the main expected outcome with the conference that is to be organized in Mombasa as we finalize.
Yeah, so I think for me, what I'd like to say is that as we hope to emerge from this COVID-19 pandemic, the future is bright. It has been quite hopeless and bleak, but then we are starting to see light at the end of the tunnel. What I just want to say is that we are not yet out of the woods. Let us continue being very careful. Let us ensure that we try to observe all the public health measures until such a time when we are sure that we are safe. And remember, we are not safe until all of us are safe. So let us get vaccinated. If there is someone you know who's not yet vaccinated, please let's encourage them so that we do not have a situation whereby after we have attained so much progress in fighting this pandemic, we now start seeing the emergence of other strains that are going to defeat everything we have done. So I think that is the most important thing that we need to look at. But with regard to the conference that we have talked about, we are really looking forward to it. All of us are upbeat. That is one of the things that is going to really inform how we can make our provision of healthcare much better in Kenya and indeed in the region. So it is a very important thing that we are looking forward to, and we can only expect to get the absolute best out of it.
All right. Thank you so much, Daktari, for creating time for us. We were talking about Matters Health this particular morning ahead of the International Conference on Harmonization of Curriculum and Training of Health Professionals. Also, the mandate of the National Public Health Institute. I've been engaging Dr. Sultani Matendechere. He's the head of the National Public Health Institute. Thank you once again, Daktari, for your time.
Thank you very much.
All right, and that's how we wrap it up right here on News Check. We are going to be paving way for the Swahili version of the program. Kurunzi Mashinani and Tamrini will be coming up shortly, so do stay for that. My name is Serfine Achieng, and our sign language interpreter has been Susan Dhuku. Enjoy the rest of your viewing.